So I'm out. I did my 14 days.
Feeling good.
I was feeling good and everything like that. And granted, I didn't, I still haven't really been out. Day 15 and 16, I was like, I'm ready to go. And I just was moving and just, and I found myself like, whoo, I'm tired. And so how after you come off of COVID, how should you move?
Yeah. So once again, everybody has different symptoms and experiences. What you did and what you just described was very simple. You listen to your body. Jessica, listen to your body, right? Pre-COVID, when you would go about your activities, daily living, up and down, things of that nature, you didn't feel that exhausted at the end of the day. However, post-COVID, you're feeling just a bit drained, okay? So listen to your body. Make sure you stay hydrated, okay? Make sure you're still getting your rest, because there are a bunch of folks that still have residual effects, sometimes weeks after, sometimes months. It just depends on the individual. And so that is not surprising that you just shared that with your audience. Not surprising at all, but to listen to your body. And when you're tired, yes, sit down and rest, and take the necessary time to let your body fully heal as well.
And that brings me to my next question, which is the lingering effects of COVID. Every time, which my mother mandated to me, in addition to my 14-day COVID quarantine, I had a mandate from my mother to call her every day. And my father, every time we talk to him, even now, says, how's that taste and that smell? How's your taste and your smell? And a lot of my listeners, I call them my nosy neighbors. They go, Miss Jessica, how's your taste and your smell? How's your taste and your smell? Which is one of the weirder symptoms of COVID, when you can't, normally it's like, if I can't taste and I can't smell, I'm stopped up. But you just feel completely fine and you can't taste and smell. So my taste and smell is back.
Oh, good.
But not fully.
Yeah.
Not fully. It's very light. I still find myself, if I really want to smell something, having to take a deep breath in order to smell it. It's still very light. What are we finding out about the taste and the smell thing, and what are some of the lingering effects of COVID?
Yeah, unfortunately, I don't have any clear-cut data as to when taste, smell, or any of the effects that an individual may experience when they will resolve. There are reports out there that individuals especially those individuals that were really sick in the hospital for prolonged periods of time, they still have residual deficits from COVID. So there's not really a kind of hard and fast understanding of, okay, it'll be 1 week, 2 weeks, and then it'll be completely back, or it won't come back at all. We're seeing a lot of different reports and can't really say 100% when an individual will have all resolution of all of their symptoms. Yeah.
Disinfecting your home. I know that you talked about that a little bit before, but after COVID is over, that was one of the first things that I wanted to do. I was like, I gotta go clean. I just feel like my home is germy. How do you do that?
Yeah.
How do you do, especially like your bed and your mattress and things like that?
Yeah. So typically, the agents that you ordinarily would use to clean kitchen and bathroom surfaces, the ones that you're having difficulty finding now in supermarkets, those typically are antibacterial, antiviral type of chemicals in these solutions are just good enough to wipe down surfaces, refrigerator handles, sink handles, a sink and things of that nature, bathroom, et cetera. I will also say that if you don't have those type of cleaning products, soap and water is great too. Okay. Soap and water is great too. Obviously, it would be better to have something of a kind of commercial strength or the kind of strength that you use to clean kitchens and bathrooms, but soap and water is great. And for hands, obviously soap and water is great. When I say soap and water, I don't mean a quick 5 seconds. I mean soap and water, 20 seconds, really scrub your hands, get the fingernails, all those surfaces for 20 seconds and then rinse and then dry. But to your point, disinfecting the household. Oh, you mentioned sheets. Okay, so regular washing of the sheets in your typical laundry is fine. Nothing above and beyond that should be sufficient. Mm-hmm.
Okay. Immunity.
Mm.
Immunity. So I will say this: both my parents live in Virginia. Mm-hmm. My grandmother lives in Virginia. My brothers live in Georgia. My nieces and nephews, my sisters, they live in Georgia. I miss them terribly. I have not seen them since December, since Christmas. I miss them terribly. And so I'm like, well, if I need to go see him, I need to go see him now. Am I immune? Like, what is going on? What are we looking at as far as immunity after you have tested positive for COVID?
Yeah. So that's a great question, and one that is receiving a lot of attention both in the research world as well as the lay press. And so when we talk about immunity from, let's not talk about COVID for 1 second. Let's just talk about immunity in general. When someone has immunity to a virus, that means they've either been exposed or had a vaccine. They develop antibodies, right? Antibodies, and those antibodies are in your memory immune system. And so that if you get exposed again, those antibodies are produced because it's in your memory immune system. Those antibodies are produced and are protective against that reinfection, okay? So that's typically the way immunity works. With COVID right now, what we are still trying to understand is, one, when somebody is exposed and they develop antibodies, and we know individuals develop antibodies to COVID, to the virus that causes COVID-19, the question is, at what level of antibody in the body does it need to be to confer immunity, right, to protect an individual? That's number one. Number two, how long does it last? Does it last for a month, 2 months, 2 years, or indefinitely? Okay. We do know that the coronavirus is a family of viruses, right? So this one is SARS, right? We call it SARS, coronavirus, SARS-2, right? So we know some other coronavirus family members, you develop antibodies, but some of those antibodies are only good for a couple of years. Does that translate to COVID-19? A lot of research is still ongoing to kind of sort that out. And so that is to say, in short, for our listeners, can you get COVID-19 after you've been exposed? Okay, well, data would suggest that it's unlikely, but we can't say for sure until more studies are published, and to what degree that an individual has immunity. Is it for a month, 6 months, forever? We still don't know.
So we still don't know if I can go see my parents.
Well, no. So okay. So let's talk about that specifically. Okay, that still falls under the typical guidelines and behavior, right? So if you go visit your parents, right? Mask for you. I'm assuming there are more seniors, so masks for you, masks for them. Physical distancing. Okay. It's still the same type of activity. Type of activity. Yeah. Okay. It's important to maintain our social connections, Jessica. It really is. It's healthy. It's healthy both physically and mentally. And so there are safe ways of doing that, and it's real important. It's real important to maintain our. Notice I didn't use the term social distancing. I said physical distancing. We want the social interaction. We just want the physical distancing.
Yeah. Okay. Okay. That's good to hear. That's good to hear.